again, everyone, and welcome to another video episode of Doctor in the Dugout. We're down here taping today in Laguna Woods, and I'm thrilled to be joined by two friends and colleagues at Hoag Orthopedic Institute, Dr. Carlos Prietto, our CEO at HOI, and Ryan Helber, who's our Director of Clinical Research in Hoag Orthopedics, which is our clinical and research arm. Thank you both for joining us today.
It's a pleasure being here.
Thank you for having us.
So I wanted to let our viewers know a little bit about today about what we do at HOI besides just great clinical orthopedic work. I mean, people in Orange County have gotten to know HOI a little bit. We've been around now for going on 7 years. Everybody knows about what we do clinically, but I wanted to explore a little bit what else we do as an orthopedic hospital. So Carlos, I'm going to ask you first. What's the role of research and education in making for a great clinical institution?
Well, when we started HOI, we realized that if we're going to have great clinical excellence, we need to participate not only in finding new avenues of treatment, but also educating those that are following us, as we've all had great people before us teach us. So we have strived then to be able to provide a rich milieu for educating higher level physicians in orthopedic subspecialties, and at the same time conducting clinical and some basic science research to develop the scope of orthopedics.
So I remember when we first started years ago and Dr. Mike Patsakis was helping us, he once said something that really stuck with me. You can be the greatest surgeon in the world and have the greatest clinical outcomes and work, but if you don't write about it, you don't report it, you don't publish it, nobody else knows about it. So that's kind of where we're going with all this, isn't it?
It is, and referring to Dr. Patsakis, I specifically remember him telling us that one paper was worth 1,000 talks, so that we had to publish, and he came and saw that we had a very good institution, but we needed to publish, and that was important to let other people know exactly what we're doing and to become the leaders that we are.
So Ryan, let's have you chime in here. What does research and education mean? Explain to our viewers what we're doing with research. What's the team? Who's the team made up of? What are they actually doing in terms of researching in orthopedics?
Sure. So as Dr. Prietto was kind of alluding, we are training this next generation of doctors, these fellows that are training with us for 1 year. The importance of us working with them is both training them on the clinical side, but also training them in research and on the education side. In the research activities we're doing with them, they're designing their own research studies, and we're working with them closely to develop research studies that will impact both us at HOI, but also the local community and abroad. And we're publishing a lot of those research articles, as you mentioned before. And that's been beneficial to us. The team that we have supporting those fellows is comprised of several clinical research coordinators. These are typically young, fresh out of college, eager to work professionals that come to us. They work with us for a few years, and they help to support the research endeavors that we're taking on. In addition to that, we also have an educational component. We have an education coordinator that helps to run our fellowship programs, helps to support our educational events that we put on at HOI, and all of the outreach activities that we're doing as well.
So there's a lot of stuff going on besides the thousands of procedures that are done every year. Patients are coming in, getting their surgery, presumably doing real well, going home, but they don't see behind the scenes how what's happening with them in the operating rooms is really contributing to the bulk of orthopedic knowledge and literature that's out there. How many papers have we really presented already in our early times, Carlos? How active have the fellows been in terms of their presentations?
I heard a number this morning of 27 so far, and I understand that we have 11 abstracts sent into our American Academy of Orthopedic Surgery meeting, which is an annual meeting for either podium presentations or for poster exhibits.
And just so the viewers understand, a fellow is somebody who's finished their orthopedic training and they're doing an extra year of their own accord to subspecialize in an area. We have sports medicine fellows, spine fellows, and total joint fellows. And so these guys and gals could be out there practicing, but they're choosing to devote an extra year to their training just to really dial it up to the next notch and be able to perform out there. Correct, Ryan?
Yeah, that's correct. I mean, we're privileged to have access to incredible surgeons that are giving back their time and training these fellows in each of these specialties. And then we have the great opportunity of working alongside them and getting to do research at the same time with them.
So just as an example, I want to bring to the viewer's attention a study that I was involved in that really is one of those studies that has a real contribution to the community. We studied how much pain medication was needed after a simple arthroscopic procedure and how many pills the physicians were writing out the prescription for post-operatively. We found the number was like 40 pills per prescription, and the average patient, we had the patients keep a log of how many pills they took, and the average was like 5 or 6, which means that 34 extra pills were sitting in that vial in the medicine chest that could be used, abused, stolen, whatever, be out there in the community. These are studies that have real world implications, aren't they?
They do, yeah. And that study in particular was impactful because it was such a small sample size of only 84 patients that we enrolled in the course of a year. And in that 1 year, we had an excess of over 2,800 pills that were still on patients' shelves that could be, like you said, accessed by the community, their family, friends, and it could be abused, potentially abused. So we're hoping that this type of research, we get it out there, we publish it, and then it changes the prescribing patterns of surgeons across the country.
And Lord knows we're in the middle of a very big opioid epidemic right now, and many people report that, especially a teenager or a 20-year-old's first exposure to these drugs was after an orthopedic procedure like an ACL reconstruction that got them started in that way in the first place.
Yep.
So how about basic science research, bench research? Do we have plans to expand our research into that as well? Because right now most of what we're doing is clinical research.
Yeah, we do. We have done most of our work and research on the clinical side because that's where most of our experience lies. But looking ahead to the future, we are planning to get into biomechanics research to help bridge the gap between a lot of the work that's done early on to test the devices that we ultimately end up using, that you end up using in practice. And we're hoping to take that biomechanics research and then transfer that into the clinical research that we do, and then ultimately get these products to the market faster. So we are looking to do that, and it's just down the road.
And we hear a lot about clinical trials, especially in some of the disciplines like chemotherapy, cancer care, and stuff like that. But there are a lot of clinical trials that were involved in orthopedics too, correct, Carlos?
That's right, and we completed or are part of a phase 3 clinical trial for a new way to patch little holes in the joint cartilage. And sometimes people will have wear of their joint cartilage, and that's non-repairable. But we participated in a clinical trial where we can take a little bit of their cartilage, culture it, and then put it back in, and it heals. And that's one that we're working on. Another one that we're just involved in also is in a new artificial disc replacement for a spine disease at the cervical level, at the level of the neck. So we have been embarked on some of these clinical trials, and we have the capacity to do that. And that's been, as we're moving along, it's been rewarding.
So traditionally, these things were done in the university setting. I mean, when we all went to medical school and residency, this is where most of this clinical research was done. But now we're finding in an institution like this, where we have a large volume of patients, this is a very right place to be doing these studies because we have the patient population.
And that's part of the mission statement of HOI. We put this hospital together, this enterprise together, to create good care for patients, but at the same time we want to do the education and the research because we have good results. So that's our obligation, our responsibility then to do the research and to get involved in these studies. So that's how it's part of our DNA.
So the whole Hoag Orthopedic tablet is really a not-for-profit. This is not directly affiliated with the hospital. It's not run by the hospital. It's not funded by the hospital. Ryan, explain to our viewers a little bit how they can get involved in terms of supporting orthopedic research and education through Hoag Orthopedics.
Sure. So, like you said, much of this is, as a nonprofit, we rely on outside funding, philanthropic funding to pursue the research that we're working on. The work that we're doing with the fellows is directly funded by philanthropic dollars. We ask that donors go through the Hoag Foundation to support the work that we do because we work closely with the Hoag Foundation to do this work. The donors can access the donation site through the Hoag Foundation site directly, or they can go through www.hoagorthopedics.org and go to the donate site within our webpage.
I know we've got a graphic up there so people can see it. One of the things that I'm proudest of is that our physicians have regularly been one of the biggest donors to this philanthropic fund for orthopedic research and education. It's nice to see that the guys who are doing the work are also supporting the work with their pocketbooks.
Yep.
That's right, and we've got the majority of the doctors, as you say, Hoag Orthopedic is a for-profit entity, but the doctors strongly believe in this as physicians because they want to give back to the community, give back to the science, continue to teach to bring the next generation of physicians up to the level. As you and I had great people that trained us years ago, and they spent their time to give us they spent time training us so that it's our turn now to train other people coming up.
Well, with stem cells and genomics and personalized medicine on the horizon, I think there's plenty of work for us to continue to do at Hoag Orthopedics in terms of research and education. I want to thank both of you for being here with us today and kind of letting the viewers know a little bit about what we're doing behind the scenes at HOI. Thank you all for watching another episode of Doctor in the Dugout on video, and we'll be back again soon. Stay tuned.